The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm your host, Don McIntosh, and today I'm delighted to be in the studio with Dr. Marianne McNeilis. Welcome, Dr. McNeilis. Now, you're a medical doctor. You've been trained in pediatrics, and you've done oncology, you've done hematology, and then you had a degree also, I believe, in microbiology.
And family medicine.
And family medicine. So with all these different things, you've come to a rather startling conclusion to some, but really a refreshing conclusion, that some of the most powerful means of healing people are some of the simplest means. And I like the way you've entitled your book. It's called God's Healing Way, and it's really focusing on those simple remedies. I like the way it's outlined too, with the different health laws and then practical treatments, and then ending, of course, with turning once again to the most powerful healer, that would be God. Today we're going to be talking about some home remedies, and you have some real strong convictions about why we should talk about what we're going to talk about today.
Thank you, Don. It's a pleasure for me to be here with you today. And I would like to share just briefly at the beginning of our talk of how God's healing is available today. What are the conditions for healing? Are they any different than they've ever been before? What are some of the biblical principles? And certainly when we look at healing, we recognize that faith is essential. In Matthew chapter 9, verse 22, Jesus said to an individual that he healed, "Thy faith hath made thee whole." In other words, your faith has made you well. However, sometimes we forget that obedience to God's laws or His commands are also necessary for optimal healing. John chapter 14, verse 15 reminds us of this. It says, "If you love me, keep my commands." My commands are His laws of not only His moral laws, His laws of physiology, His laws of good health are also included in God's commands.
Okay, so we really all have the opportunity of receiving that gift of the Spirit, which is faith, the fruits of the Spirit are love, joy, peace, long-suffering, faithfulness. Right. And then what you're suggesting is then that obedience is a fruit of faith. It comes right out of it, and we can kind of know whether or not we're in that relationship with Jesus by whether or not we have that fruit in our life of obedience. Now, let's just role play, I guess, with a couple things. You have a few things that you want to show us here that are very practical approaches to dealing with disease or discomfort. Maybe what's the first thing we want to talk about here of all the different options we have? Today
I would like to talk about fomentations. What are fomentations? They are applying a hot and cold to a body area, often using a towel or a similar large cloth to a particular body area.
Okay, so for what reason? Just because you want that particular reason, that particular area to have treatment. I suppose it would be an area that you can't submerge.
That's right, and this is why it's hard. And if you have an illness or an infection in a hand or foot, you can submerge it into the hot and cold water, such as with the hot and cold contrast bath. But if you have an area such as your rib cage or chest area, abdominal area, back area, these areas are not easily submerged locally, and so you need to take a hot towel or cloth fomentation cloth and apply it to that area, and apply hot and cold, having the same principles as submerging in hot and cold water to a particular body part.
So let's say I don't know, maybe I broke my ribs, I ran into a tree, who knows, or something like that, and then I have a lot of pain from that, and I'm not breathing as deeply as I should, and I start to develop bronchitis, pneumonia. Would fomentations be a good treatment for that?
It's one of the best treatments. Fomentations have a wonderful application in chest illnesses such as asthma, bronchitis, and also chest injuries such as rib cage injuries.
So let's, what would we do? I mean, okay, should I hold my chest? I ran into something, and actually I have broken my ribs before, so I know how to do this.
Right.
And
I'll be happy to show you here.
Okay.
I preface this one with a little story as well. One of our Amish bishops in our area had a buggy accident. And one Saturday, his son called our home just as we were leaving for church. And he said, I know this is your Sunday, this is your rest day, but my father has had this severe rib injury, and now he seems to have pneumonia or something like that. He's coughing up very thick sputum, and it's very painful. Is there any way you can see him today? And we assured him that there was. And so he came over to our place for a treatment. And what we did is, for the treatment, we put his feet in hot water to decongest, to help in also decongesting the chest area for the treatment. And then we put some hot towels to his chest. And I'm going to demonstrate to you how we heated these towels.
Okay. So
and how we did that.
Have a special pot here. You can use any kind of pot at home. But,
that's right. Well, if we're in a society where you have a microwave, the microwave actually works is a very nifty way to do that as well. Let's take this towel, for example. This towel is just a dry towel, and I folded it widthwise twice, and then I run it under the tap water to get it completely wet. And so we'll pretend this is a wet towel, not a dry one. Then I roll it up and wring it out so that it's damp but not sloshy or soggy.
Okay.
And then I simply put it in any old plastic bag that I have around. So I save my grocery bags for such a purpose.
You need to put it in a bag, though. You shouldn't put it in there.
It's best idea to put it in a bag.
Okay.
And then I put it into my microwave, turn it on high for anywhere from 4 to 8 minutes, depending on the size of the towel in the microwave. After it is heated, then I will apply it to the body area. But say if I go to an Amish home where I do not have electricity, or some parts of the world where those things aren't available, what do I do?
I bet you're going to talk about the pot now.
The pot comes into play now.
Okay.
You can use any large pot. A canning kettle is perfect, but not everyone has a canning kettle, or not even everyone has a little wire basket. What you can do is get some kind of a steamer, and one thing I have done to make a steaming pot out of this is that I need to put some water in this pot about 1 or 2 inches level. I'd probably be a little bit closer to 1.5 or so, at least over an inch, because you don't want the pot to run dry while you're in the process of steaming, which will take about a half an hour. What I have done actually, if I've made a little improvisation here, this steaming apparatus for steaming vegetables is a little bit low, and I want it a little higher. So I took an aluminum pan, punched holes in it, and put that upside down in the bottom of the pot, just to give
right over the water.
Just to give it a little raising there. And then I just put this little steamer contraption right here.
Okay.
And you can use any type of wire conveyance, just enough to bring the level of the towel above the water level, because you want it just to be steamed, not boiled.
And then you put your towel in there on end. Huh?
Yes, then you have your wet towel exactly like you did for the microwave. You fold it, you wet it, you wring it out, and then you have it just damp, and you lay it right in here.
Oh, okay.
And
you can put a couple in there if you want.
You can put anywhere from 1 to 3, and often I will put 3 in this canning kettle. Then I will put it on the heat, whether it's a wood stove or electric stove, it doesn't matter. Within 30 minutes, usually the steam will come up and heat the towels.
Okay.
Now, how do I get the towel from there to your chest?
That's a good question.
Well, you are going to demonstrate that today.
Well, I aim to please.
Let's see.
The doctor is in, and so is the patient. So my
That's
rib hurts,
right.
though, so be easy on me.
That's right.
Okay.
And what we're going to do, because I don't have a wool blanket here, often I put the hot towel within a wool blanket to kind of regulate the heat a bit. But since I don't have that, I am going to just triple the layers here, and I'm going to put this dry towel right over the area where I want to put this hot towel.
Okay.
Now,
I would be laying down normally.
normally you'd be lying down. You might even have your feet in hot water to kind of even increase the effectiveness of the treatment, but you don't even have to do that. Now, you can use the tongs or you can use an oven mitt, but since I don't have either one, I'm just going to use a little pair of spoons here to lift this out because it's quite hot. I may lay it actually out on a table, which I'm just going to pretend my lap is, and I will lay it at one end and actually roll it out very quickly. And then very quickly I would usually just wrap this in a little wool blanket. But since I don't have that, it's going to go right on there.
Okay, and I wouldn't really normally touch it, but I'm going to today.
And in order to keep it from losing much more heat, I'm going to put a dry one right on top. So it's like the hot filling of a sandwich again.
All right, there you
The
go.
dry towel.
How long is that good for?
Now you're going to start to feel better quite soon. It's going to relax the muscles, and it's going to kind of bring the blood to the surface to decongest that area. And we are going to leave that on for anywhere from 5 to 7 minutes.
Okay, so then what does it do? It
helps to decongest that area under which there is an injury or an infection.
Brings blood to the area?
Yes, it brings blood to the surface area, which will decongest that area underneath there, where it helps to move the blood. Again, it's causing a movement of our circulatory system, which takes away waste and brings in nutrients and white blood cells.
How many times do you do this then?
We will leave that on, and another thing we will do often, which we won't demonstrate here with you since you were bundled up once before with one of our treatments, but we would normally have your feet in, say, a hot foot bath, and we would cover you with a sheet or a blanket so that you could sweat in there, and that's another way to release
How do we close
toxins.
this off?
Well, now that it's getting comfortable, we'll take it off.
The whole thing?
Then we'll take the whole thing off. We'll take this
the whole thing off.
And then what we usually have is a pan of cold water nearby. We always seem to have to get that cold in there, don't we?
Yes.
And we'll pretend we have this pan of cold water, and this is cold. And often what we'll do, we'll take it and make kind of a little mitt, and we'll just lightly rub that area very briskly, but gently, because it's a little bit sore. It hurts. And we'll do that about a half a minute to a minute. And then we will dry it off with another towel. We'll just dry it off so that it's nice and dry here. And now we're ready for the second towel. So we will again
do the same thing again.
Up here, the dry towel. And this time we may want to put this one back into steam if we need to, or we'll pick out another one and repeat that process for a total of about 4 to 5 changes.
4 to 5 changes, and then several times that day?
It can be done anywhere from 1 to 4 times a day, and it can be continued until pain relief and healing have begun there.
We're talking with Dr. Marianne McNeilis, and she's telling us that sometimes the simplest ways of addressing issues are really the best and most effective. When we come back, we'll learn more. We hope that you join us.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Deal and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Deal and Dr. Ludington have been featured on 3ABN, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. If you just joined us, we've been talking about the pharmacy in your kitchen, and our pharmacy specialist is Dr. Marianne McNeilis. Looks like we actually are right now into the refrigerator area or right into the kitchen. It looks like you have, what is this, a potato, an onion, some cabbage, and various tools to lay those things waste if we need to. What are these for? What are we going to be doing now?
We're going to demonstrate some poultices that can be applied to injured or inflamed parts of our body that can be very effective in the healing process.
So potato. Is that what you're going to talk about first?
Let's look at the potato. And I've got my sleeves rolled up here and my kitchen counter right on my lap.
All right, great.
And we are going to look at the raw potato. Potato poultices are used raw, and they can be used just about anywhere for any condition. They can be used for eye infections, for red eye, or inflamed eyes. They can be used for burns or injuries or infected areas.
Okay.
Pretty much the same places you can use charcoal.
So you just grate them up fine like this?
Yes, the potato must be used raw, and it can simply be grated.
All right. You grate that. Can you make them bigger than that? With the can you use that other bigger section to grate them even larger?
Well, this would certainly take quite a while, wouldn't it? Let's see here. Let's just, for the sake of our...
But normally you do it small like that.
Smaller is probably better. It'll get more mushy and juicy, which is kind of what you're looking for.
But mashed potatoes doesn't work.
No, hot mashed potatoes aren't quite what we're looking for in this case.
Okay. All right, so you grate that all up, and what are the healing properties in a potato?
Well, you know, it seems like potato has a lot of minerals, such as potassium, other things that the Lord seems to have put into it that we are actually just discovering certainly have healing properties. It seems like the mineral combinations, the magnesium, potassium, things like that, do have properties that are able to promote healing process. And so what I want to do is show you how I make a simple poultice. I've gotten the raw potato.
Okay, great. Those look ready to go. That looks...
And this is a small poultice. This can be, for example, for an eye infection. So let's just make this a little bit smaller.
Okay.
Here.
I hope that the Food and Drug Administration is not watching. They'll probably find some way to market this and sell it.
Well, I tell you, that's one reason these ways don't have a lot of market value, because it's hard to improve on God, isn't it?
Okay,
some of these
all right.
things.
So we put the little shavings of the potato inside a piece of paper or whatever.
Or a loose-fitting cloth or a cheesecloth, and then you can apply it to the infected body parts.
All right, let's say it's my hand.
Sure, we'll put it right there, or it can be a red eye, infected eye.
Best for eyes, huh?
Excellent for eyes. And my husband had a sore eye one day not long ago, and we did a hot and cold contrast to his eye and put the potato on. He raw potato poultice right over his eye, closed his eye, and right over the eyelid, over the eye. He rested for about 30 minutes, and that was the end of his inflamed red eye.
Is that right? Now, is this antiviral as well?
Well, that's a good question. It does seem to have properties that do help with burns or infected areas as well. It does seem to normalize some of those tissues. And so there are things in the potato as well that absorb, in this case, substances that are toxic and to promote healing of the tissues underneath it.
So you do a contrast bath, and then you can put this poultice on. How long do you keep it on?
Similarly to a charcoal poultice, for several hours or overnight.
Okay. All right. So then can you do the same thing with an onion, or what do we do with, oh, we're going next to the cabbage maybe.
Well, let's take a look at a cabbage.
Okay.
Cabbage is excellent for bruised edematous tissues. For example, if you have turned your ankle, sprained an ankle, or are fallen and have a severe bruise that's very painful and swollen. It is also good for breastfeeding mothers who have maybe what we call a mastitis, or inflammation or congestion of the breast tissue. And this type of treatment is excellent for that. And how you do the cabbage is simply you can chop it up or cut it up a bit, and then take some pieces of wax paper, or we can simply use the plastic like we did here, and put it between the cut up pieces between the plastic, and then just roll it with a rolling pin, or blend it a bit in a food processor, whatever you have to, or mash it up a bit till it's kind of bruised and juicy and moist.
Then it does its magic.
It does, and you simply can put it in a loose-fitting cloth or paper towel, the same as you did the potato. Again, the raw cabbage is best used in this situation.
Excellent. I can't wait to try it. I mean, you know, you don't want to get sick, but I'm almost looking forward to trying some of these things.
They're a lot of fun. I've had a chance to try this too. This is the onion, which has a lot of good properties, and I'll share a few of these with you. First of all, we're going to get out the Kleenex here for our eyes, because I am going to cut this onion, and I'm not sure how hot it is. I just purchased it this morning. Now, the onion has a lot of excellent properties as well. There was a while back, croup and whooping cough went through our Amish community, and a lot of children were whooping, and there are different times in the springtime when viral croup syndrome comes around, and we have even small babies and toddlers coughing and carrying on. And what can we do for them? And certainly one of the fine things that can be done for them is to cut up or grate up onion the same way we grated the raw potato. With our little grater here, we can grate it or mash it up. And I will just pretend that I did that. And then we will place our grated onion, again, in a loosely woven cloth or a paper towel. And then we can put it either on the chest, or sometimes even for earaches, it can be put to the ear. It has good properties in it.
Is it a vasodilator?
Well, it tends to have properties in it that tend to be more of a relaxant. And so that
makes swelling go down and everything.
Yes, in cases where there's swelling and edema from a viral croup or from asthma, it tends to relax those smooth muscles. It does also have some antibacterial properties that are similar to antibiotics properties. And can be used for boils or abscesses as well. But one that I really like to use it for is for croup in small babies. And I will often just take the grated up onion, and we'll just simply put it right next to the bare skin on the chest, and then just take a piece of plastic to cover that, because of course the onion is good and juicy.
Doesn't make the baby cry, does it?
Surprisingly, it doesn't seem to that much. Babies do a little bit better. And then we can take a towel or some type of a heavier cloth and cover that and pin it securely in place so that can stay on the baby's chest. And often that will be...
How long?
For several hours or overnight.
Have you used any of these things in the mission field? Have you ever used a poultice or different things in the mission field?
Yes, I have had opportunity on numerous occasions, but I would like to share with you one particular story that stands out in my mind. One day, a poor Cambodian widow lady brought her 12 to 13-year-old boy to me with what appeared to be quite a serious condition. He had been sick for several days. In fact, he had not been able to keep his food down well for several days. And by the time she brought him to me, his left eye was so swollen that it was actually pushing out of the orbit of the socket of the eye.
His eye was so affected that he couldn't even keep food down.
That's right. And he was nauseated, he was vomiting from some irritation in the brain. And by the time I saw him, his eye was actually protruding a bit out of the eye socket and pointing downward. And he could not see. When I asked him if he could count my fingers, he could not see a thing. I asked him where he hurt, and he pointed to the entire left side of his head. I realized his situation, his illness was indeed a serious situation, that the inflammation could have well already traveled down the optic nerve, and this illness can cause a brain abscess or meningitis. And yet the poor mother had no money. The hospitals were very marginally supplied at that time, and I said to her, "Do you want to see what God can do with his simple things?" And she said, "Yes." That was my clue to work with him. And with a prayer in my heart, I put his feet in a hot foot bath. I put hot and cold towels to the entire left side of his head for about 3 to 5 changes, hot and cold. And then I put a large charcoal poultice covering the left eye and the entire left side of his head. After we put this on, he was able to rest for the evening. Several hours after he had rested, he woke up actually feeling better, was able to eat an orange and actually keep it down. The next morning, when I checked his eyesight, I found that he could actually count my fingers. Not well, but he could see enough to count fingers. At that point, I let him go home with his mother under the direction of one of our lay pastors who was well trained in natural remedies. The mother continued the hot and cold water treatments and the charcoal poultices for another 2 weeks. At the end of 2 weeks, I received a welcome letter that the young man was now pain-free and could now see well.
And this is a picture of him.
Yes.
That is just incredible. That was really a miracle, wasn't it?
It truly was.
Well, it also was you stepping out in faith and using God's healing way, not in any, cautiously and yet courageously. We hope that as a result of today's program, you'll learn and have confidence to use God's healing way. And if you would like more information about the book, get in touch with 3ABN. Thanks for joining us. We hope you have health that lasts for a lifetime.